you say the first few years is quite science based, how much of that is sort of nutritional based as well? So, or is it all just, I don't know how to phrase this, but is it all primarily on like your organs, the body, the cells, but do you also look at the effect that nutrition has on different conditions and cells and stuff? Or because I've heard that, like from other people that have studied medicine, that they don't do a lot of studying on nutrition. But is that the same at UCL? Or?
We had a module called Fluids, Nutrition and Metabolism.
Oh, yeah.
Yeah, we did.
We did.
If you remember that, I think it was second year. In terms of the split for the first 2 years, it's building on biology from GCSE biology knowledge. And it's very organs based. So like you were saying, like you'll do the respiratory system, you do the cardiac system, you look at that, the hormonal system. We did have a bit on nutrition. I think that kind of thing is a bit more clinical. You learn more in terms of management and how like things like diet, exercise, lifestyle affects conditions when you're explaining it to patients, for example, or you're learning how to treat and manage conditions. Is that what you were sort of getting at?
Yeah. Well, I don't think it's like nutrition focused. Like we don't have anything specific. And as well as that, I think what I realized is doctors are very like specialized. So if you want to know more about nutrition, you're most likely going to see a dietitian regarding that. So there's always like a big team with people who are more specialized and a bit more niche on certain things.
I think because from our like conversations off of camera, we've both had that experience from the patient side where like nutrition and lifestyle really isn't taken into account. It's just like here's some medicine rather than looking into more like root causes. It's like symptom treatment rather than root cause treatment.
Yeah.
I think that's also telling of the NHS as well. Like you have so much turnover. You just need to give a patient something to sort of treat them and then move on, kind of thing. But now we are seeing things like social prescribing. So the idea of like prescribing literally people to different community groups or things that might actually help them heal in terms of the environment that they live in, rather than just giving them a medicine. And a lot of what we are taught in terms of management is got a conservative like at the forefront. So before you give pills and before you do surgery, what's their lifestyle like? Are they smoking? Are they drinking? What's their diet like? That kind of thing. So maybe that's something that's changing.
Yeah, and I think there's even been like strides in terms of being very like having culture, using culture as a context as well. Like in terms of diet, like you're not going to tell someone who like someone like me who primarily has a diet like because culturally like of rice and meat and stuff like that, which may not be the healthiest thing, but you can't just tell me to cut that out altogether because that it won't make sense, especially if that's something that I've like grown up with. So I think that's another thing that I've seen doctors doing in terms of like looking at how your culture, your background, where you live, all of these factors come together to essentially influence someone's health, because it's very easy to just treat someone as a body and like as a human, but imagine they're going back to an environment that's just making them sicker, which I've seen like quite a few cases actually. Like you see people pleading to their GPs, I can't live at home, like I've got asbestos, or there's so much pollution and it's like making my asthma worse, or my COPD worse, which is like different respiratory conditions. And it's like, wow, like sometimes you see how limited I guess doctors are in terms of helping people. So I think sometimes even though it does seem like they're treating symptoms, there's also I guess a part of them which is like you need to know your limits. Like you can only help, but only help so much as well, which is unfortunate. But
it seems like you need like several specific people rather than one general person.
Yeah, we have this concept called the multidisciplinary team, the MDT. So if you're doing like interviews or if you're doing personal statement writing, you need to throw that buzzword in there. But essentially, there's lots of different members of different teams that are going to be involved in caring for a patient, and the patient's also part of that team. So we were saying like doctors will only get you so far, but you need to look at like physio or occupational therapy. Like is their home safe for them to go to? Do they need mobility aids? Do they need help with their cooking and cleaning and general activities of daily living? So it is a very holistic kind of approach, and that's only something that I learned having done clinical placements and speaking to patients, because as students we have a lot more time than a 10-minute session that a doctor might have. So patients are more likely to tell you and open up to you, and you really see that it's not straightforward. It's not ever black and white. It's loads of grey area. Doctors do their best, patients do their best, but again, there's just so many factors to consider.
Thanks for watching this clip of the Education Lounge podcast. To watch another clip, click up here or here. To watch the full episode, click somewhere down here. And don't forget to like and subscribe, as it really helps the algorithm.
The Education Lounge podcast.